So next, I'm going to perform the Leopold's maneuver. So ma'am, ang next natin gawin is the Leopold's maneuver. So it will determine the position and then the presentation of the fetus. So we must observe the mother's abdomen for its longest diameter and where the fetal movement is apparent. The longest diameter is the length of fetus. The location of activity most likely reflects the position of the fetus, of the fetus rather. Well, first, we must warm our hands by rubbing against each other. So because it will aid comfort and it prevents the tightening of the abdominal muscle. So first, we're going to perform the first maneuver by raising the patient and then place both hands on the fundal area and palpate. So when palpating, determine the consistency, the shape, and mobility because it will tell us if it is the head or the buttocks of the fetus. So this maneuver determines whether the fetal head is in breech in the fundus. So usually the head is hard, round, and ballotable while the buttocks is soft, globular, and non-ballotable. So mami, lagay ko na po yung hands ko. So we're going to put it like this. And the next is the second maneuver, which is the umbilical grip. Again, face the patient and then place the palmar surface of the both hands on either side of the abdomen and apply gently pressure. This maneuver locates the back of the fetus. This method is most successful to determine the direction of the fetal back on where it is location. So, we're going to place our hand like this. So, ma'am, lagyan naman po natin yung kamay ko sa gilid ng iyong tiyan. Hold the left hand stationary and on the right side of the uterus while the right hand palpates the opposite side of the uterus from top to bottom. Then hold the right hand steady and repeat palpation using left hand on the mother's right side. So we're going to do it like this. Apply pressure. One hand will feel a smooth, hard resistant surface that is the back of the fetus, while on the opposite side, a number of angular nodules, that is the knee and the elbows of the fetus. And the next, we are going to do the third maneuver, which is the pollex grip. And again, face the patient, head, and then gently but firmly grasp the lower abdomen, just above the lower abdomen, just above the symphysis pubis between thumb and finger of one hand pressing together. So we're going to do it like this, ma'am. Gagawin na po natin yung third maneuver. So I will going to place my hand in this area, ma'am. So this maneuver determines the part of the fetus at the inlet and its mobility. So we're going to do it like this. If the presenting part moves upward, on examined hands can be pressed together. The presenting part is not engaged. So it is not engaged. So not firmly settled in, it is not yet firmly settled in the pelvis when it is not yet engaged. So if the part is firm, so it means that it is the head. So if it is soft, then it is in breech position. So next, we're going to do the last, which is the fourth maneuver. Or it is what you call the umbilical or pelvic grip rather. Sorry for that. And so we're going to face the patient's feet. Dito. Sa feet tayo ng patient. Okay, assuming that nandito na tayo sa feet ng patient. And then after that, face the patient. This maneuver determines fetal attitude and degree of fetal extension into the pelvis. So it should be done only if the fetus is in cephalic presentation. So assuming that the fetus is in cephalic position, so we are going to do the fourth maneuver. So information about the infant's anteroposterior position may also be gained from this final maneuver. So we're going to assume that the baby is encephalic, or the fetus rather is in cephalic presentation. Then we're going to place our fingers both sides into the uterus approximately 2 inches above the inguinal ligaments, pressing downward and inward in the direction of the birth canal. Allow fingers to downward. So we're going to do it like this. So the fingers of one hand will slide along the uterine contour and meet no obstruction, indicating the back of the fetal neck. The other hand will meet an obstruction on the same side as the fetal back. So it is the fetal